Going on, everybody? Happy Thursday. Cool. So, all right. Sorry for any delays, guys. We're getting this thing fired off. So, good evening, everyone. I'm Dr. Joaquin Acosta, your guide and host on this enlightening journey of the Know Your Pharmacist live stream. As the CEO of PharmTrue, I'm thrilled to bring you another episode filled with crucial insights, groundbreaking discussions, and heartfelt stories that connect us all. Tonight, we're diving deep into a topic that touches millions of lives: the complex world of Medicare. We'll unravel the myths, understand the truths, and empower you with knowledge to make informed health choices. So imagine this: a loved one unsure about their healthcare options, feeling overwhelmed. That's just where we come in. We're not just discussing policies, guys, we're safeguarding futures, ensuring our families, friends, and communities receive the care that they deserve. So there's more. We're stepping into the future with AI and healthcare, exploring how technology is revolutionizing patient care. And no, it's not science fiction, it's here and it's transforming lives, guys. CarePod's first AI doctor pod, it's crazy. In our Herbal Wellness Corner, we'll spotlight a significant step in cannabis. The introduction of THC oil in Georgia's pharmacies makes, even more of a disrupting shake in the medical cannabis industry. Very, very interesting follow there. As America's first retail pharmacy with a cannabis dispensary, this is something that, the CEO of PharmTrue is definitely looking at for sure. But THC oil, it's awesome. We are big proponents of that. CBD to THC oil, high strength CBD with low strength THC, 10 to 1, 5 to 1, 20 to 1, as endorsed by Dr. Bonnie Goldstein, Dr. Dustin Sulak. These are combos that, if anything in the murky research industry of cannabis is, time and time again starting to work for people with some healing, geez, it's that. So anyways, we'll also honor a true community hero, Roberto V. Estrada. His legacy from Roberto's is a testament to the power of passion and generosity, guys. I know everybody wants to bring back the whole enchilada fiesta and everything there. And in light of Men's Health Awareness Month, after that, we'll share vital tips and knowledge, because caring for health is not just a choice, it's a responsibility that we share. So join me in this journey of discovery, empowerment, and community spirit. Together, let's learn, grow, and transform the way we think about health and wellness. Thanks for tuning in, and let's make this one a night to remember, guys. Starting this thing off, some weird news to share. Just, we don't always share things to just frustrate people. But right here. So there is basically a big time fraud going on in Florida. A pharmacy company bribed doctors with hunting trips, gym passes, and $54 million scheme. So this is actually TRICARE scheme, excuse me there. We're talking about this one first, and then we'll be talking about the Medicare stuff in our Enlightenment Hour. So let me get you guys right here. Pretty intense. So pharmacy company bribed doctors with hunting trips, gym passes in a $54 million scheme that they were using over here to do compounded medication. So basically, it was a Florida-based pharmacy company that were sentenced in what federal officials are calling $54 million of fraudulent prescriptions scheme. 3 men were sentenced in the scheme. which officials said the company bribed doctors to funnel scripts to their company, Florida Pharmacy Solutions. And this Florida Pharmacy Solutions company, what they did, compounded medications, which consist of combining or altering ingredients to create a product for the patient's individual need. What they did was they're accused of targeting physicians who serve patients on TRICARE, which is a health insurance plan for military members and their families. The men received sentences for ranging from 1.5 years to over 4 years in prison in connection to the scheme. So, anyways, so what they were doing was they were getting basically like millions of dollars in kickbacks because they figured out like the glitch to get paid better by TRICARE reimbursements and compounding. Were able to set up their pricing and incentivize the doctors, paying off the doctors, with kickbacks such as, right, hunting trips, gym passes, so on and so forth. And we'll talk a little bit more about this. Like buttering up your doctors like that is truly illegal, right? You're talking about total kickbacks. So the what was happening here again, from 2012 to 2015, the company billed the health insurance program for $54 million. In the end, they were able to receive $41 million from that. The company bribed physicians with lavish hunting trips, expensive dinners, and gym memberships to solicit exorbitant reimbursement payments from TRICARE, officials said in the release in the memorandums. CEO paid another two men millions of dollars in kickback based on the percentage of the amount that TRICARE reimbursed for their prescriptions, which provided an incentive to seek prescriptions for the most expensive compounded drugs possible, including pain and scar cream. So crazy there, right? The manager set up companies to receive and funnel the kickback. So really, again, it's illegal for pharmacies to incentivize doctors and reward them, monetarily or with other bribery there to fill prescriptions. So this was a $54 million, issue here in our country. And geez, to tell you the truth, it's just probably one of the very many, and it's just another testament to our broken healthcare system. So I won't touch on that too much longer. Just interesting news. But on the cool end, in our tech talk, we're talking about primary care player Forward. So a company called Forward unveiling AI-based self-serve care pods. This is cool. So check these things out. Sharing it right here.
This is not a doctor's office. It's Forward, the world's first AI doctor's office. It all starts with the CarePod, an entirely new approach to healthcare with prevention at its core. With health apps in every category to choose from, we're here to treat the issues of today and prevent the issues of tomorrow. We'll start by establishing a baseline of your health, diving deep into all aspects of your health, past health history, current health state, future wellness goals, body scan, biometric monitoring, blood testing, genetics, and more. It's all about understanding where you are today, where you want to be, and how to get there. After establishing a baseline of your health, you're able to personalize your care with health apps curated for you, like our Heart Health app, proven to lower blood pressure in 90 days. Powered by in-person and remote biometric monitoring, you'll be able to detect murmurs and other irregularities and lower your risk of a heart attack or stroke. With a focus on keeping you healthy, you and your care team will be equipped to make the right decisions for your long-term health. Or our Skin Cancer Scan app, to track and monitor things like mole growth, skin lesions, and discolorations over time. Or our Mental Health app, to monitor anxiety and depression with ongoing guidance and support. Whether it's weight management, diabetes screening, or everyday care, like a routine blood draw, COVID-19 testing, or kidney and liver health, there's something for everyone. Because health isn't just about seeing a doctor when you're sick. It's about continuous, comprehensive care that addresses your health concerns today and prevents those of tomorrow. The world's first AI doctor's office. It's Forward.
Guys, so that thing, oh my gosh, that thing is loaded. Like talking about how cool is that? I mean, AI doctor's office, obviously not trying to replace the doctor by any means, but think about how much of a help that could be where you have like, AI really helping you manage your blood pressure, your diabetes. They're checking for skin cancer, your mental health, whatever, all these things that are built into this functionality there. And it's going to be deployed not in your most conventional places here, right? So the AirPods, I think, are going to be not AirPods, excuse me, CarePods are going to be out in malls and in gyms. So other public spaces as well that, very interesting place for sure. And I'm guarantee you're going to start seeing them in pharmacies, and other, little clinics here. And again, I really don't think this devalues the job of the doctor. I think it could really assist, a lot of that primary care workup and some of that time that it takes to triage patients for sure. But then on top of that, where it can be a little bit more analytical and kind of like follow that, that's pretty cool. Geez, that's all I got to say for sure. So let's move on to the next segment, guys. This one interesting because I saw a couple people resharing a post on Facebook. And so I'm going to show you guys this because I think it's important. And I think it's another thing to bring up. Let's talk about Medicare Advantage. So Medicare Advantage versus traditional. And I'm going to take you as far as I know, as a pharmacist and from what I've seen and things like this. But this is an interesting thing. So this is more than I've ever even seen. So again, considering your options here, Medicare versus Medicare Advantage. So everybody over the age of 65, you're eligible for Medicare in the United States. So health insurance, Medicare, health insurance for all Americans 65 plus who worked and paid into the system. So you and your doctor choose, you don't need referrals, you have no restrictions, no lab fees, no pre-auths, no hidden costs, and full coverage. So very interesting there that you and your doctor get to choose your care versus Medicare Advantage, where your plan chooses your care for you, not your doctor. So that's where, some of these plans like Humana, Aetna, Cigna are going to prefer certain medications over others. And especially when it becomes, they make it a real big hassle in the pharmacy world specifically for you to be on one drug versus another. All of a sudden you run into the issues of, the prescribers having the time and the ability to get these overrides to get you on, whatever medication you might need at the time, which is interesting there. So other things apparently contrasting with the highly restricted referrals, limited specialists, MRI and outpatient high fees, upfront copay on ER visits, high deductibles, and limited coverage. So crazy, and maybe Las Cruces may be a different place because, most of our systems are going to probably service both with us having, 3 hospitals here in town and things. But again, this is still a very important consideration because check out this comment, guys. It says, please, please, please do not switch to a Medicare Advantage plan. Honey, they are a disadvantage at best. Tell your parents, grandparents, your elderly neighbor who walks around the whole neighborhood 8 times a day and inform them. Example, that neighbor falls during one of those 8 trips around the neighborhood and fractures her hip. She'll be able to have it repaired, but the rehab options are abysmal. Right along with nursing homes for rehabilitation, slim pickings for in-network options, and fat chance finding anything close to home. She'll be in a very difficult and stressful situation, and she won't be able to do a thing about it. Choose wisely. Right there. Very, very interesting, right? Keep that Medicare A and B and grab Part D. Plan for your medications. Perfection. So that's what this says. And if you guys have had Medicare, somebody who's going to be on Medicare, comment, your opinions as well. I think it's important. So, some of the comments in the section there, yes. And if you do, and it's an HMO plan, please make sure your provider is in network, not all facilities accept it. Especially a Medicare United Healthcare replacement plan. These people type their plans up and then suck. So scary, right? I feel so bad for the elderly people who get taken advantage of by someone calling them and offering them things such as this. We should just tell them to only get Medicare. And right, so all kinds of comments, it's rough. And how do you even get to know to make what decision? It's like, well, are you working with a provider at all, that you like? Because if you do, then that can help, right? Then you're like, all right, well, what's preferred, with my provider, with my preferred pharmacy, things like that when you're shopping for Medicare. But who are you going to shop that with, right? For instance, we've always recommended Distinguished Choice Insurance Solutions, specifically Clarissa Acosta. She's been the one who's really been taking care of our Medicare and Medicaid patients, I think even initially now, but Medicare supplements, Medicare Advantage, Medicare Part D. She can really talk to you about the plan for you. So it all becomes a very specific thing there. And now's that time. People are signing up, so on and so forth. So again, make sure to try. I hope and pray to try to not get people. Hope that people don't get taken advantage of, and anything like that. But the best you can do is try to advocate out there. So I put Distinguished Choice Certain Solutions. Clarissa here in the comments. Why isn't it loading? There it goes. Boom. So I definitely would reach out to a professional insurance broker, such as like a local person that actually knows these things and is keeping up with it, because your medical providers are only going to kind of know maybe very slim things, because you only really look at it when it causes you problems, right? It's when you only really look at it. So maybe you might know what's preferred for you, but you're not going to know any of that nuance. So that'll be that for Enlightenment Hour. Guys, let's talk about City of Douglas approving THC oil sales at 3 local pharmacies. Pretty cool. Respect. Let's put this video on there.
Georgia patients with an active low THC oil patient registry card will soon be able to purchase THC products in Douglas.
WALB News 10's Mackenzie Petrie joins us live in the studio with those details.
3 local pharmacies in the city of Douglas are adding low THC oils and products to their shelves after city commissioners voted 5-1 to approve the request in Monday's commission meeting. The 3 pharmacies adding the THC products include both medicine cabinets in Douglas, as well as McCrae's Pharmacy in Douglas. City leaders say this is their first time receiving this type of request, and they're happy to approve it.
It will benefit the city, tremendously. It's been, passed by the state legislature, and, you have professional pharmacists that be filling the prescriptions or the medical marijuana, THC oils and tinctures and such, so I don't foresee it to be a problem.
Although Georgia was the first state to allow pharmacies to sell medical marijuana, a few lawmakers feel the current law is way too strict. State Representative Eric Bill says he plans to introduce a bill reforming the state's marijuana laws.
So anyways, as you can see there, they're able to do this low dose stuff for medical. Very interesting, right? I mean, definitely think this is cool. So just want to remind everybody in our Herbal Wellness Corner, brought to you by High Horse Cannabis, the carrier of our Farm True brand products. Guys, we've been doing these products for the last 4 years, and we've been really perfecting our craft. This is pharmacy has been my obsession for a really long time now, and that's talking like we're looking at 10 years. So we got that, and we've been doing Farm True for the last 4, and we've been really getting better and better every single year. We've developed products for specifically, again, medically inclined reasons, such as opioid epidemic, getting off of bad medications such as benzodiazepines. What's a great way to do it? Our Farm True 1-to-1 THC CBD tincture. It's a perfect starter option there for your cannabis confused, your cannabis naive, and even your cannabis curious people there. Of course, talk to your healthcare provider before you do want to initiate any sort of cannabis therapy, anything like that. We will talk to you about drug interactions. If you do absolutely need to know from us, we've got that information as well, but we want to make sure that before you kind of embark on any journey of starting to substitute meds or even take on cannabis if you're new or somebody in your family is, definitely just mention it to your healthcare provider. Make sure you got the green light, and we've got you from there, guys. $20 is a very affordable option. You've got 31 ml doses of 10 milligrams times 10 milligrams CBD and THC in a nice, beautiful score dropper. These will last forever. So like I'm telling you, granted their expiration is a year, but really amber, violet light, and MCT oil. It really does last. So anyways, not trying to make it seem like that should last, but it's like some people do wonder about well, what if I only need it this time or something like that? So want to make sure that we do educate in the right ways. There's so many different reasons to try so many different things when it comes to the cannabis industry. And I just think it's cool when you're looking at the CBD, City of Douglas, talking about THC oils there, guys, in pharmacies. We are Farm True. We pharmacists formulated cannabis. We've been doing this now since we got our cannabis license last year, but we've been doing it since the CBD industry in 2019. So we've been doing pharmacist formulated CBD, now pharmacist formulated cannabis. We're able to use everything we learned to even get better and jump in and do what we do there. So guys, I think, Georgia, if you need any questions, call me, because I'm telling you, we've been here, telling you. And so for everybody seeing these kinds of headlines in the national news, don't you forget, that little David versus Goliath people down there in Las Cruces. You guys are still pushing. Anyways, let's move on. Community Spotlight brought to you by the Baked Chicken Farm. Honoring Roberto Estrada, guys. Everybody in Las Cruces knows this guy was a local legend. Founder of the whole enchilada fiesta. Roberto's delicious Mexican food. And, everybody here in town knows it. But tomorrow at 3 p.m. in the Plaza of Las Cruces, they're going to rename the stage in memory of him, a beloved resident, business owner, and philanthropist. So, again, reading off here, Roberto, founder of the whole enchilada fiesta, left an indelible mark on our community with his famous world-breaking flat red enchilada and countless contributions. Let's celebrate his legacy at the newly named Roberto V. Estrada Pavilion tomorrow, 3 o'clock. Plaza de Las Cruces. Encourage attendees to wear the whole enchilada fiesta t-shirts or pay homage to Roberto's impact on our vibrant community. For those of you unable to join in person, ceremony will be uploaded to the city's YouTube channel on Monday, November 20th. So shout out to Roberto Estrada. I really love those bean and cheese burritos from there. Tell you the truth right now. I'm not even gonna lie. They call me Dr. Beans, Joaquin the Bean. It's all been that. Bean and cheese is kind of a staple thing. Anyways. All right, so Men's Health Minute, guys. Lastly, November, again, Men's Health Awareness Month. So let's chip away at some recommendations here. So recommendations for men's health beginning at age 20 and beyond. I like this list. Get an annual physical exam by your primary care provider, including blood pressure and height weight checks. Annually screen for testicular cancer. That includes monthly self-exams. Having cholesterol testing every 5 years. Screen for diabetes, thyroid disease, liver problems, and anemia. Depending on risk factors, screen for cancer, sexually transmitted diseases, and HIV infection at 30. Screen for coronary heart disease, especially with a strong family history of the disease and or risk factors. At 40, men screen for thyroid disease, liver problems, anemia, and prostate cancer. At 50, screen for cholesterol every 5 years. Annually screen for type 2 diabetes, lipid disorder, and skin, colon, and lung cancer. Obtain a shingles vaccine. At 60, screen for depression, osteoporosis, dementia, Alzheimer's disease, abdominal, aortic aneurysm, and have a carotid artery ultrasound, artery ultrasound, guys. At 70, depending on previous findings, some screening may need to be done every 6 months. Men's health, regardless of age. Men have more difficulty handling stress than women, partially because women have better social networks and more friends with whom they can confide. Thus, men should seek out more friends, whether they are male or female. Laughter increases endorphins, thereby increasing longevity. Get a sense of humor and engage with others with whom you can laugh. Men avoid tobacco products and non-prescriptive drugs. Got my tongue twisted for a second, excuse me. Avoid sun exposure. Research the reliability of vitamins or herbs before starting them. Make sure it's recommended by professionals, not just the manufacturer of the item. And I would even edit that to say something like, talk to the healthcare provider that's actually working with you. And if they're not working with you, make sure that you know that they have your best interest in mind, right? Don't become a workaholic. It increases stress and it can lead to health concerns such as hypertension and weight gain. Get a hobby that helps you decrease stress. Exercise in the manner you prefer and seek help with diet to maintain desirable weight. This one, I think, be who you are, right? I mean, I don't exactly believe in the word workaholic because, some people have different speeds that they want to have on the pedal. If it's affecting you, sure, you're a workaholic. But, if you're doing what you love, is it work? So again, the balancing of things, you can definitely make the argument for that, especially with what responsibilities you have to the world. But again, I don't think being a workaholic should be a shameful thing by any means. By any means, we need a few more people who need to understand that 4-letter word, work, here in this country for sure, and even in the world. Anyways, men, especially young men, are known for engaging in risky behaviors, wear seatbelt helmets when riding bicycles or motorcycles, don't text or talk on the telephone when driving, and avoid friends who encourage illicit drug use and high school alcohol consumption. If sexually active, get tested regularly for sexually transmitted infections. You might think you are safe. You engage in sexual activity with only one person, but that person might be having relations with others. Concept called serial monogamy. Some people are polyamorous. Whatever it is. The Guttmacher Institute reports that some boys start having sex at the age of 10, and that number increases each year until by the age of 20, 75% of men and boys engage in sexual activity. Therefore, start safe sex education in home and at school by the age of 10. So those are the recommendations here for our Men's Health Minute, and we went through it. Anybody else have any questions, let me know. Otherwise, we'll plan to see you guys tomorrow for Friday.